Staff have always played a pivotal part in the NHS. There's been a lot of celebration around the Windrush and the fact that when the NHS needed additional workforce, they went to the Caribbean and recruited a number of individuals to come over and work within the NHS. So you know, BME staff have always been in the NHS, and I think that's a really proud legacy to have. My own parent, my mother, came over from Jamaica to work in the NHS. She came over and did her training. So I've always had something instilled in me which is about the history and the richness of being somebody from a BME background working in the NHS. Yeah, diversity is really important. There's something about the richness that it brings to organisations, and that could be BME, but it could be other characteristics. And you could even say diversity in thinking brings a certain difference, because if you are somebody from a diverse background, you're able to understand the issues of the population a bit more, you're able to inform the organisation of what that might be, and that's one of the things I hope that I actually bring to DCHS. Being somebody from a BME background, I can then demonstrate what it means to be that BME staff member, and also give, support staff in understanding some of the challenges which other staff might face, which populations might face. So diversity for me is really important because it does give that richness, and I think particularly within Black History Month, it just gives us an opportunity to really celebrate the BME component of the NHS. The other bit that I'd like to say as well is that you can really have a positive impact on patient experience. If you are a diverse organisation, if you welcome individuals regardless of what their characteristics are, then you can only have a positive impact on patients, and that's research driven as well, that's well known. Okay, so I started in the NHS in 1985, and some people have heard this already, but my mum was a nurse, so my mum came over from Jamaica, and she came to do her training to be a nurse, and she trained in Selly Oak in Birmingham, and my dad also came over, and he was in the RAF. So I've always had something about public service ingrained into me, and the ethos of the NHS has been something that's really strong. So I knew relatively early that I was going to go into nursing, and in fairness, I've had a lot of support and mentors along the way, and I've had the opportunity to talk to people who have enabled me to get to the position that I hold now. I think I'm in a really important position, being a chief nurse from a BME background. Not only does it say to staff from BME background, actually you can make it, but I hope that I can be a role model and I can encourage people to aspire to be the best that they can be.